Good morning. I'm Dr. Basa, one of the doctors in this GP surgery. Uh, are you John Bernard?
Yes, doctor, I'm John Bennett and I'm 36 years old.
Okay. How would you like me to call you?
I think John is fine.
Okay, John. Thank you for confirming. I can see from your notes that you have some. You made this appointment as you want. You have some concerns. Can you tell me more about it?
Yes, doctor. So I was in a holiday in Turkey last week with my family, and I was in this park just relaxing. And there was this wild looking cat which just came out of nowhere and it just bit me. So I'm really worried about it, about this bite and what's going to happen to me.
Oh, I'm really sorry to hear that. It should be very scary for you as well. I'm very anxious about this. Yeah, I'll definitely see what I can do for you. Okay?
Yes, doctor, I'm just worried about this.
Yeah, yeah, definitely. But before that, going further, can I ask you a few questions about you to get
Yeah,
it
sure,
better?
doctor.
Yeah. So when was this happened exactly?
So this happened yesterday, and I just returned back to home,
Okay.
and I'm just worried about this. What's going to happen to me?
Okay. Yeah, definitely. I'll address your concerns. But do you have any symptoms at the moment?
No, not at the moment. Maybe a little bit of pain, but I don't
Okay.
have any other symptoms.
Okay. Okay. Is there any discharge from the wound? Any
No,
bleeding?
not exactly.
Okay. You said about the pain. Is it? Can you tell me what type of pain is it?
It's just a blunt pain, at the wound side. So it's just where the
Okay.
cat bit me, and yeah.
Okay. Does it go anywhere else?
No.
Okay. Does anything makes it better?
I just visited a doctor in the A&E over there, and they just gave me some paracetamol. Maybe that has helped me a bit.
Okay. Okay. And does anything makes it worse? Like.
I don't know, doctor. It's just a
Okay.
little bit.
Okay. No worries. Can you please score your pain on a scale of 1 to 10, 1 being the lowest and 10 being the high?
Maybe it can go around 4 or 5.
Okay. At the moment, do you have any pain, John?
A little bit, not much, doctor. I'm just worried about this
Okay.
infection thing.
Yeah, yeah, definitely. I'll see what I can do for you. Okay. Do you have any nausea feeling?
No, doctor.
Do you have any vomiting?
No,
Any tummy pain?
no.
Any swelling around the wound?
Not that I can see of.
Okay. And can I ask you, where did the cat bite you? Is it on the hand?
Yeah, it's just bit me on the hand in my, I think my index finger over there.
Okay. Is there any redness over there?
A little bit of redness just near the wound.
Okay. Okay. Can you move your finger freely, or is there any pain while movement?
I can, but there's a light pain, but not much.
Okay. Okay. Is this the first time you are bitten by a cat?
Yes, doctor.
Okay. Have you been diagnosed with any long-term condition?
No.
Okay. Are you on any medications, or even the over-the-counter one, apart from the paracetamol you have taken earlier?
No, doctor.
Okay. Are you allergic to anything?
I just remember my GP saying that I'm allergic to penicillin.
Okay. Can I ask? Okay. Okay. I'll make a note on that.
Yeah.
Definitely. Thank you for saying that to me. Okay. And is anyone in your family has any long-term conditions?
No, doctor.
Okay. So what do you do for a living?
I'm an architect.
Okay. And who do you live with?
I live with my wife and my 2 daughters.
Okay. Can I ask you, does anyone have the bite? I mean, bitten by the cat as well?
No, doctor, it was only me.
Okay. 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 That's reassuring. Okay. Can I ask you more about your lifestyle?
Yeah, you can.
Yeah.
Two
What do you
minutes
eat for?
remaining.
Sorry?
What do you generally eat?
I just eat my normal balanced diet.
Okay. Do you drink alcohol?
Maybe occasionally.
Okay. Do you smoke?
Um, no, just at times.
Okay. Have you taken any vaccination? Are you up to date with the vaccination thing?
Yes, doctor. As far as I know, I have taken my tetanus vaccines up to date, and the last dose was just a year ago.
Okay, okay, okay. Thank you for answering my questions patiently. Now, I would like to examine the wound, and also before that, I'll check your observations, which include temperature, heart rate, breathing rate, and also respiratory rate. Okay. Okay. Thank you for letting me examine. Based on what you said and on examination, I found wound on your index finger, and uh, as you and 80 and for as you said, you have been taking paracetamol. For now, I'll be giving you some antibiotics for this. As you said, you are allergic to penicillin. I'll be giving you other antibiotic, which you are not allergic to. We'll also do some skin prick test for that as well, if you're allergy or not. Okay, and
Okay.
we'll give you a painkiller as well, and anti-inflammatory as there is swelling over the wound. So we'll be giving anti-inflammatory as well. Will that be fine?
Yes, doctor. I'm just worried if I need to take any rabies vaccination because I just heard these cats and dogs are, we need to be careful about them. So what should I do about it, doctor?
Yeah, rabies. There's yeah, we will be giving you some
Move on
vaccination
to
for
the next
rabies as
patient.
well.
All right, Dr. Kalyan, thank you so much.
Thank you.
Don't worry about it.
Yeah.
Yeah, usually
Mm,
in these scenarios, you do get a little nervous.
yeah.
Sorry for the technical issues, but not bad. You
Okay.
covered. You managed to get into come to the management section, though a
Okay.
little late.
Yeah.
Right. So we would like to definitely give you some advice, but before that, we have Dr. Umar with us.
Okay.
Umar, when you're ready, you can just raise your hand, then we can proceed with the explanation bit.
Yeah, just give me 2 minutes.
Yeah,
All right.
absolutely. So until then, we can just help you understand how you could have done this. Yes,
Oh
Dr.
yeah, yeah.
Nivedita
Okay.
has
Yeah.
something to say.
Definitely.
Go ahead, Dr. Nivedita.
Yeah, I just wanted to tell a few things. Is that okay?
Absolutely, yes.
Yes.
Please go
Yes.
ahead.
Yeah. So, Dr. Kalyan, it was a really good thing. You were calm and yeah, you did quite well. There's just a small thing that as your exam is in 2 weeks, right? So, we can just work on our timings. We can just leave out some questions which are not very necessary for the case. So, we need to tailor our questions based on our case, right?
Okay.
So, in most of the cases, the social history, the diet history, and all that is not much necessary. So, only in cases where, like, eating disorders or something like that, we can ask them just to know about it better. But in other cases, we can just cut it down. And even we can just ask as, one word questions, any medications, any allergies, or something like that. So, we need not put it into full frame questions. We are just saving time, right? I
Yeah.
think
Time.
time is
Yeah.
the very important thing
Most
here.
important. Yes.
Yeah, so the most important thing is your management. So even if we do a full data history, we'll just get 4 marks, right? Another 4 marks lies in our management. So we just need to go up to that and we need to show our IPS also in management. So we can just rush it or rush the data gathering and we can go to the management part, especially in these type of cases because we know that it's a cat bite, right? We need not diagnose
Yes.
anything.
Mm.
So in cases which
Okay.
you don't know what's happening, maybe we can take some more time in data gathering. But in these cases, I think that will be a little bit helpful. And please don't forget
Okay.
eyes. Eyes is very important. Idea,
Okay. Yeah.
expectations, and
I keep on
yeah,
forget that. Yeah.
yeah, that happens a lot. But I think if you just manage to remember that, that will get you a lot of marks over there.
Yes. Mm.
Yeah, so I think Dr. Umar is ready and he will tell you further.
Okay.
Yeah.
Hello. Can you hear me, Dr. Kalyan?
Hello. Yes. Yes.
So, your exam's in 2 weeks, huh? Nervous.
Yes. Yes.
Okay. let's talk about today's scenario. Shall we start like you did good? Okay, in a general review, you did
Mm,
good. You were nervous. Okay. Okay, I
mm,
noticed a thing in that 2 minutes. Like you don't smile when you approach a patient. Okay,
okay,
looking
okay.
happy or smiling is really important to calm your nerves and to build a rapport.
Dr. Umar.
Okay?
Oh,
Okay, that's great. Okay, so I was telling like always start or approach a patient with a smiling face.
okay.
And the things that you did good, you confirmed the name, age, okay, the reason for the visit, you addressed the concerns. When patient John told you, like Dr. Navita told you, that the cat bit on your hand, okay,
Mm,
your first response should be to like you did show empathy, but your empathy was like,
okay.
bookish. Uh, like you said these words, okay, to John, that you understand that it must be an anxious situation. You understand this must be a worrisome situation. You did say these
Yes.
words, but the way you said it, it didn't look sympathetic or empathetic.
Okay.
Okay, so you need to work on your emotions. After that,
Mm,
you need to explore the incident. Like John did tell you that the cat jumped on it, or him, sorry, and bit on him, and there was a blood. So you need to explore the incident more. Like what happened?
okay.
Was it a provoked? Was it a wild cat? Was it a sick cat?
Okay.
The blood came out. What did you do? How did you stop the blood? What happened in the emergency? So these kind of questions about the incident history, like before, during, and after, it's
During and after,
really,
yeah.
really important.
Okay, yeah. It makes
Okay.
sense.
Yeah,
Mm,
always in such incidents, not only this animal bite, in all incident, you need to take the incident histories.
mm, okay.
After that, doing all of this, the other things you must ask is vaccination history. Okay, whenever a
Okay.
person gets injured, what do you do in a normal practice situation? You ask about the tetanus vaccination. And
Yes.
in
Yeah.
animal bites, in rabbit bites, you always ask about the rabies vaccination. That are really important. You did ask
Okay.
about the tetanus, but you forgot about rabies, and John had to, remind you the
Yeah,
concern
I
that.
know. Okay. Yes.
Okay, yeah.
Mm,
Moving forward, you asked about past medical condition, allergy history. That was really good. Okay, you did all the PMF DOSA. Well, I want to mention out that you ask about like what's your diet, what do you generally eat. I don't get it. Like, what is the need of such question in this scenario?
okay.
Okay, you need to cut these unnecessary questions to manage your time.
Yeah. Mm,
Okay, are you getting me?
okay. Yes, yes.
If I'm going too fast, you can just tell me. Okay.
Yeah.
Okay. After that, you did the social history, smoking, alcohol, living situation. That's good. You skip the ice part, idea, concerns,
Mm,
So you need to ask, like, why is the patient so much concerned? If you have already asked that, the patient must have told you about the rabies vaccination that
rabies,
he's worried.
yes.
Okay. So you skip that part and you missed that point, which was really important.
Mm,
In examination, you said that you want to check, heart rate, blood pressure, respiratory rate, temperature. That was good, and examine the hand. Okay, in
mm,
infections, like in animal bites or in injuries, you always also check the lymph nodes.
lymph nodes, okay.
Okay, so
Yeah.
either way, when you ask for examination, they will give you that chit mentioning all of it. But it would be better that you know that in such cases you need to mention the lymph node examination as well.
Lymph nodes, yes. Okay.
Another thing, moving forward, after doing the examination, always tell the patient, like, thank you for cooperating, thank you for letting me examine you. You have been a great
Mm,
patient. Always encourage them that they have done the right thing by coming here. Okay, you kind of missed all of the empathic statements which could have made much more closer to the patient.
Okay.
Other than that, in the management part, okay, so you did tell that you would be giving her antibiotics which won't be reacting to penicillin, but you didn't mention those medicines. Okay,
Okay.
in allergic to penicillin, you gave metronidazole and doxycycline for 3 days in this scenario.
Okay. Okay.
Okay, and
And docs. Hmm.
yeah. In generally speaking, like whenever a patient comes to you in a hospital setting with such an injury, what do? You give them antibiotics, prophylactic antibiotics.
Yes.
You clean their wound by a warm saline. Okay, you bandage it, and for the pain, you give painkillers. Like it's a normal,
Hmm.
routine in all hospital settings.
Yeah, yes.
Okay, so you mentioned about prophylactic antibiotics, but not the names. You mentioned about the
Okay.
analgesia. Okay, but you didn't mention the wound care. Like, what would you do for the
Yeah.
wound right now, and what should the patient do for the wound at home?
Okay.
After that, I guess like the time short off, you need to mention about the follow-ups, the leaflets, the safety netting is really, really important in this scenario because right now there is no fever for the patient, but it may
Hmm.
develop. That's why
Yeah,
you're
that's
giving
yeah.
prophylactic antibiotics. So you need to mention, the safety netting.
It's really important.
Okay.
And for interpersonal skills, I would say that your communication, like your English flow, your fluency is good. You encourage questions. Okay, you ask patient questions so that they answer you. You allow the patient to express the concerns. But regarding
Okay.
empathy and showing understanding, that I would say that you need to work on.
Okay.
Okay, and a few last points that I would really like to tell you. I know that you are nervous. Okay, it's like just from my point of view. I just know that by looking at you that whenever you practice scenario, your heart races, your heart rate increases. So just take a deep breath, slow down your speed, let patient finish. The John Bennett was speaking, Dr. Nivita was speaking, and you continuously said like, okay, okay, let patient finish. Just nod your head. Just show by your
Okay.
body language
Knowledge.
that you are yeah, just show your by your body language that you are listening actively, that you are responding actively. Don't interrupt because sometimes candidates have orders from the examiners or that whenever the uh, doctor interrupts, they should stop. So don't interrupt.
Okay. Not.
Just show your body language that you are listening actively and you are there to help them.
Okay.
One thing that I really want to ask, have you read this scenario before, like during practice with your colleagues?
No, I haven't done this.
Okay, so that was
Mm.
considering that it was a good one. You need to work on your IPS. You need to work on your time management. And for that, the advice that I will give for the IPS, smile, take deep breaths,
Okay.
and make pauses while you speak. You have a very,
Okay.
you speak really good, but you need to take some pause, like to make sure that you are understanding the patient and to make sure that you are understanding the patient.
Okay.
Okay, so always, counter check by asking the patient, are you getting me? Are you following me? Is there anything that you want to ask again? Is there anything that you want me to recap? So that's something that you need to do, again and again for the patient, because the patient is really worried that whether the infection would fester or whether there would be need for an rabies vaccine, because for rabies vaccination there are 5 shots. So a patient is really
Yeah.
worried.
Very worried.
Yeah, so you
But
need to.
should we give the rabies vaccine now? I got the doubt, so I was
No,
not
the thing
sure.
is that actually the thing is that Turkey is a country with a high occurrence of rabies. So a patient has come to you with a cat bite, asking for a rabies vaccination. What do you do right now is that you involve the senior. You involve the senior that whether you should give the rabies vaccination or not. You currently you cannot give the rabies vaccination. You will discuss it with the senior.
Okay,
But
right.
but you need to ask and mention the vaccination names. Like tetanus and rabies are
That
important in animal
mm,
bites, and tetanus is important in injuries.
okay.
And yeah, just pause, smile. Incident history was important. Cut down unnecessary questions, please. Like one more thing that I noticed regarding listening you, when the patient told you about the cat fight, like I don't think whether there was a need to ask this question, like, have you been bitten before?
Okay.
Like, I don't think that there was a need for this question. And similarly,
Like I
when you
thought he would be getting vaccinated that time, so I thought it would be best to ask.
okay, like your intention was right, but regarding this question, you missed the vaccination point. It was in your mind, but you didn't speak it, so the examiner didn't know.
Yeah.
Okay, so, and one more thing about family. You ask another question like, is there anyone else in the family who has been bitten? It was
Okay.
a good question regarding empathy, but it wasn't needed right here because you need to manage the scenario in 8 minutes. The time is like flowing. So you need to cut down these unnecessary questions. And like in PMS TOSA, you don't need to ask about eating habits, exercise habits, okay, and occupational. Like, what? There isn't any need for it.
Okay.
Uh, yeah, one more thing. Last point. Sorry, I'm taking too much time. Last thing.
Okay,
Uh,
no problem. So
okay.
just nodding
So
would be fine, right?
nodding, saying, okay, you can also say, all right, John, I understand. That must be really bothering. The John will continue the story again. You just nod, and at the end, you again say, yeah, I can see that you are really worried about it. So there is no need for saying, okay, okay, okay. Without interruption, you can just nod. Okay, you can show with your hand movements, with your body language, with your just head nodding. You can say many, many things with only your body language. So I would ask you to practice on this with your colleagues.
Okay, yeah. I'll do
Other than
that.
that, it was good. Considering that you haven't done this scenario before, it was good. You don't need to be nervous. Just take deep breaths and pause while speaking.
Yeah.
Any question from your side?
Okay. So I got one question in the mail, but that she was really concerned about this and keep on asking, like, I'm really concerned about this. What would you like to do? And what are you gonna do? Then how can we stop that? I mean, politely stop her and continue with our exam management.
So you
So yeah,
hi, yeah, you can continue.
Dr.
Hello.
Umar, you want to take this?
I saw. Yeah, I didn't get his question, so I was just gonna ask to repeat.
All right. I just got his question. So he was mentioning that if the patient is prematurely asking for the management during data gathering, how do we deal with that? So, in such scenarios, when you feel like you have to get into management even before finishing your data gathering, you can mention that to the patient, saying, "I'd like to understand a little bit more about the situation so that I can give you the proper management." Right? So that's exactly what
Okay.
you're trying to do as well. So mention that
Uh,
to the. I'm sorry. Go ahead, Dr.
yeah,
Umar.
sorry, I've just interrupted you. Sorry, Dr. Kian, I got this same, question from my exam in my exam. Okay, and what did I say regarding it? That it was said. I just said. Uh, It, I can understand, John, that you're really worried. I can see that you're really bothered as well. But regarding your situation, I would like to ask a few more questions and then I would like to examine you so that I get a clear grasping of the situation and then I would like to manage or treat you. Is that all right? So you always show empathy and always end the empathy with a question, asking the patient whether he feels comfortable or not.
Yes. Yes.
Okay, so this is the trick that you do so that the all burden transfers onto the simulator patient, and he is forced to say, okay doctor, you can do that. That he then he will cooperate with you.
Yeah. I got
Did you get
it.
me?
Yes. Yes.
Any more questions?
No, that's.
Thank you, Dr. Kalyan. If you have any more questions, you can always ask us in the group, okay?
Yeah. Thank you.
Thank you, guys.
Handing
Thank
over
you, Dr.
Thank you.
Nivedita.
Yeah.
Thank you, Dr. Umar, for that expert feedback. It was very detailed. Absolutely. I don't think you
Yes.
missed any points there.
Mhm.
But regarding the nervousness, I have a couple of things to say. So think of the simulator as a real patient, who might come to you. You might actually try to put yourself in that
Mm.
position of the simulator. Imagine
Yeah.
if you get bit by a cat in a
Mm.
foreign country, then your first reaction is you don't
Mm.
know what will happen next, right? You don't know whether you need to get vaccinated. I'm sure you must have encountered a situation where you got a deep wound, or you must have gotten bit by some
Yes.
animal, or you might have had encounters with such patients. They don't know what to do next. That's basically
Yes.
the patient will come with concerns like, what do I do next? Do I need to get vaccination? I've heard about vaccination. What do I do? What vaccination? So even when situations when you don't know the management, you can actually say that at this point, be very transparent about that fact. Say that at this point, I'm not really sure about the rabies vaccination, but I would like to check with my senior, and I will definitely get back to you on that. Don't show the fact that you
Okay.
don't know. In fact, if you don't know, tell that very clearly, and
Mm.
mention it in a way where you are not going to just let that slide away. You are going to get back to them with a proper management plan.
Okay. Yeah.
And so I just wanted to tell a couple of points. So what Dr. Uma mentioned about your interpersonal skills is very, very important. You have to smile,
Mm.
because it's
Mm.
gonna hurt you a lot, because you won't realize that it's you might feel it's not that big of a deal because you won't look at yourself, right? But the person who is
Yeah.
looking at you, they will definitely make note of that, because that gives them a sense of ease. Whenever you see someone smile, it puts you at ease immediately, because that's a natural reaction, and that is something you have to make sure you elicit, because that will let your entire station go smoothly. Because it's basically like, they will like you as soon as they see you. Okay, yeah, this doctor is smiling, it means probably I can talk
Open
to
up.
them openly, yeah. So
Mm.
try to
Yeah.
practice that more. Keep looking at yourself in the mirror and practice, because otherwise you would never know what you're doing.
Yeah. Now I'm seeing, looking at my mirror only, just doing, trying to smile.
Yeah, so while you're practicing, also try doing that. Record yourself and then look at it again, and do that. And other than that, most of your interpersonal skills are okay. So you're empathizing. You know what phrases to say, but it's coming out a
Mm.
little rehearsed. That there's
Okay.
not much you can do for that other than just practice. Just keep practicing at least one case. Right now you have only 2 weeks, right? At least do 5 cases
Yes.
every day. All right, that is your
Mm.
target.
Yeah.
5 cases you have to do every single day. Make sure you try to record yourself while doing and watch them again. That will become 10 cases every day, right? You do 5 and then watch them again.
Yeah.
That's
Yeah.
basically your
Watching. Mm.
at least doing 10 cases every day, like that. So that will
Okay.
make it so that it becomes a natural when you're talking, when you're giving the empathetic responses. It just comes out very naturally. And
Okay.
other than that, you have to work on your data gathering. Your data gathering, you're
Mm.
asking way too many questions, like Dr. Umar said. It's very difficult to know what questions that you don't have to ask. But one thing you need to know is that you don't have much time. You have 4 minutes for
Mm.
data
Yes.
gathering and 4 minutes for management. So not asking a few questions is not going to penalize you much. The more you lose more marks in management by just asking too many questions. Okay, that is very very important. It's okay, just ask. Date. See, main thing is presenting complaint, elaboration of presenting complaint, that is Socrates or Odipara. And here if it's an incident, it's incident history. Instead of Socrates, you do incident history, that is before, during, after. So do that. And then immediately ask red flags. Red flags are very important for every station. Just ask, just think about what's the worst thing that can happen. So in a cat bite, the worst thing is infection, right? Just ask quickly a couple of questions about infection. And then vaccination history. So PMAFTers, think about what is most important in this. You don't have to worry about smoking, alcohol, diet, all these. Good to ask, but there's no point. You don't have time. So just ask about vaccination history, past medical history, and any medications, allergies. Because you're going to give antibiotics, always ask allergies. That's all.
Yeah, but I just want to add one point, because you will be giving metronidazole in this case. It's good to ask about the alcohol history, because there are some medications you can't take with alcohol.
Yeah.
So that would be relevant over here. So that's
Mhm.
why you should know what medications, but not necessary. If you don't know the medications, also you can always say that I will check my book, that is the BNF, and you can always prescribe the right medications.
Yeah. So that is, your data gathering has to be very crisp and to the point, and make sure you know when your 4 minutes is finishing. That is something that only comes with practice. You need to know, without even looking at the timer, you need to know when your 4 minutes is finished, and you need to start management. So starting management, there's sorry, we muted you. There's a lot of noise. You can raise your hand if you wanna unmute. And management, you're telling the right things, but make sure there are always 3 points in management that you have to always cover. And what we tell everyone is, whenever you hear the 2 minute bell, you started your management probably at 2 minutes bell, but ideally you should start it at 4 minutes. And at 2 minute bell, you should be doing three things in management, that is safety netting, follow up, and leaflets and pamphlets. All right, these three things will come in every single station, and these three things will give you one mark each. Like, you, even if you don't do anything, even if you don't know what the medication you're gonna give, if you give safety netting is not just telling warning signs. Safety netting is, even if you just say that, oh, I'm not really sure what to do right now, I'll just talk to my senior. Nobody is gonna hurt you for that. They, in fact, they want you to do that. If you don't know something, they want you to say that you don't know, and you will ask your senior. All right, that's very important that you show that to the examiner. So make sure you just say a few things about safety netting. That is, I'll tell you what to look out, what warning signs to look out for. I'll also find ask my senior and let you know what we need to do. And I'll give you some medications. I'll check my book and I'll give you some medications. This basically means that even if you don't know anything, you can just finish this, right? That is safety netting. And then follow up. Follow up is also part of safety netting, if you think about it, because once the patient goes from your consultation room, you don't know what's going to happen to them, right? Unless you set up a follow up for them. That is, if they come, you don't know where they're going, but you might refer them to a specialist. We don't know if the specialist is seeing them, or you don't know if the specialist has given some other way of treatment to them. So all these things will get solved by just saying that I'll see you again in a couple of weeks, so just to see how it is going, right? That means that you telling them that I'm not just sending you away, I want to know what's happening to you, right? That is follow up. And leaflets and pamphlets. So leaflets and pamphlets are just any station just blurt out this sentence saying, I'll give you some reading material, or I'll give you some leaflets and pamphlets so that you can learn more about this. All right, this will save you in every single station, because that is, even if you don't cover everything, the examiner will know that, okay, this guy knows about say leaflets and pamphlets, meaning that even if there is not enough time in the consultation, they will give enough information to the patient, right? That is something that has to be done in every station. Okay, so three things: safety netting, follow up, leaflets, and pamphlets. These three things you have to do every station. Management is not complete without these three. Okay, and yeah, that's all.
All right, guys. Thank you for your participation, all the masters as well as our candidate, Dr. Kalyan. Well, I had a great session. So, Dr. Kalyan, good luck.
Please like and subscribe to Turing Med School. Good luck with your preparation.